Okay, so now moving on to complement proteins. So we said there's a group of proteins that are produced by the liver, just like the coagulation factors, and they participate in innate immunity, right? Participate in innate immunity. And uh, one of the products formed by this complement system is the membrane attack complex, right? So, but there are three main outcomes of the complement system. One is inflammation, right? Three main outcomes: one, inflammation; two, destruction of the pathogen using the membrane attack complex, right? And then three, opsonization, where the white blood cells come in and swallow up the pathogen or antigen, right? And there are three ways of activating these complement proteins. So number one is the alternate, number two, classic, number three is lectin. So the classic pathway involves antigen antibody complex. So an antibody will bind to the antigen and then activate a group of complement proteins, that's C2, C4, and then those C2, C4 will combine to form your C3 convertase that will now go on to activate C5 and others and produce C3A, C3B, and the other proteins that will carry out all these three effects that we mentioned, three outcomes. Right. Then the alternate pathway is the microbial surface. Right. The microbial surface that will activate C3. Right. The other thing they didn't mention here is there are other factors here. Look at this factor B. Right. Factor B, factor D. There's another one, properdin. So those, when you hear factor B, factor D, they are talking about the alternative pathway. When you hear antigen antibody complex, right, activating complements, they're talking about this one. They're talking about the classic pathway. And then when you hear the lectin, which is not the the least common of the three, it involves the mannose binding lectin, which will also activate the C2, C4, C2 and C4 pathways, right? So the mark, like we mentioned, there is one of the outcomes of activating the complement system. Then there's the test they mentioned here, CH50. So there's another test. There's two main tests to evaluate the complement system: the CH50, AH50. Okay, CH50, AH50. So the CH50 tests the entire complement system from C1 to C9. All right. So in that one, you're looking at C1, C2, C4, C3, and the other. So you're basically evaluating more of the classical pathway, right? The AH50 will look more of the alternative pathway. That's the factor B, factor D, then C3 to C5, C9. So that's why you're evaluating this pathway, right? The alternative. So this is AH50, all right? And then this is CH50, okay? So, and then remember we said earlier that two main immunoglobulins, IgG, IgM, are the ones that activate this, unlike, they're the only two that can activate the complement system. So what are the functions of it? We said there are three main functions. One is inflammation. So remember, look at this. C3A is involved in mast cell degranulation. We'll look at that when we get to type 1. So C3A, C4A, C5A. So C3A, C4A, C5A are involved in anaphylaxis. That's type 1 hypersensitivity reaction, right? Then C5A also has another function here. It's a neutrophil chemotactic agent. Another agent that is that stimulates neutrophil chemotaxis is leukotriene B4, right? Leukotriene B4, right? So then the other thing, yeah. So C5A, besides anaphylaxis, is involved in neutrophil chemotaxis, just like leukotriene B4. Okay, and then the C5B, C59, C5B, C59 are involved in forming the membrane attack complex, right? And then C3B. So the main opsonins in the body, C3B besides one, so C3, software C3 breaks down to C3A and C3B. So one of the main function of C3B is opsonization. So remember we talked of immunoglobulins carrying out opsonization. IgG and C3B are the main opsonins in the body, the two main opsonins, all right? Two main opsonins. Then another function of C3B is to help clear immune complexes. That's antigen antibody complex, right? Antigen antibody complex. Now, this MAC complex, before I move on, this MAC complex is very important in Neisseria infections. So a deficiency of this mark or deficiency of the complement proteins will lead to recurrent infections with Neisseria, right? So the MAC complex is one of the main complex in neutralizing or protecting the body against Neisseria infection. That's Neisseria, particular Neisseria meningitis, for example, or Neisseria gonorrhea, right? Then what are the inhibitors of this pathway? We have the decay accelerating factor, also called CD59, right? Decay accelerating factor, also called CD55. There's also a CD59, right? There's also a CD59. So what do? They protect cells of the body against this activated, because they help to inhibit the complement proteins. Because these complement proteins, they can create this MAC complex, right? That's one. Or they can create this C3b can tag normal cells, which will lead to destruction of those cells by white blood cells, all right? So the inhibitors CD55, CD59 help to deactivate the complement systems, all right? And then there's a C1 esterase inhibitor, which also helps. This one particularly blocks C1, right? The C1 complex that we're looking at here. Okay, so those are the inhibitors, CD59, CD55, C1 esterase inhibitors. Right, so moving on. So what are the disorders of the complement system? So you can have the two main disorders. One is where you have deficiencies of either of the members of the complement system. Number two is that you have a disorder involving the inhibitors of the complement system. Those are two broad categories of disorders that can affect the complement system. All right. So for looking at the deficiencies of the complement individually, it can involve either the early complements, that's C1 to C4, or the late complements. All right. That's C5 to C9. Now, when you hear of the deficiency of the early complements, one of the most important disorders I want you to think of is SLE, systemic lupus erythematosus. So, in this disorder, there's an autoimmune disorder. We'll look at it when we get to autoimmune conditions. The body is producing antibodies against its own antigens. And remember, I said antigen antibody complex tend to activate the classic pathway. Okay, so it will activate the classic pathway. So that means C1, C2, C4 will be low, all right? C1, C2, C4 will be low. So that's what in fact, you have a disorder in this SLE called hypocomplementemia. Okay, hypocomplementemia is one of the things you see in SLE, but it's involving the early complement system. Then if you have, moving on from that, so if you have that for the late terminal complement proteins, C5 to C9, right? Remember, C5 C9 forms the MAC, and the MAC is very important to protect against Neisseria. So if you don't have the MAC, you have recurrent Neisseria. You have deficiency of C5 C9, the MAC will never be formed. And the MAC is never formed, then the body can't defend itself against Neisseria infections. And this patient will come down with recurrent Neisseria meningitis or Neisseria infections, right? So some of these things, part of the things you see, the CH50, when you evaluate with CH50, AH50, if they both alternative and complement a classic pathway, their ultimate goal is to produce those three pathways, either inflammation, MAC complex, or opsonization. So if you're having recurrent Neisseria meningitis, that means your CH50 and your AH50 will be abnormal, right? So that's something that you should remember. Then moving on to this, when you have your C1 esterase inhibitor deficiency, right? Remember C1 esterase, we say is to block C1, right? The classical pathway particularly. So another function it does is prevent the conversion of kininogen to bradykinin. Okay, C1 esterase also blocks that. Besides blocking the activation of, so it blocks this and it blocks this. All right. So if you don't have C1 esterase inhibitor, or if it's absent, then bradykinin will accumulate. And if bradykinin accumulates, is a potent vasodilator and increases vascular permeability. That's bradykinin, which will lead to angioedema. All right. That's due to elevated bradykinin. And angioedema, there are multiple subtypes of it. Right. There's a hereditary, as you've seen there. there's the allergic, and then there's the acquired form of it. So there's difference. So this one is due to the presence of the absence of C1 esterase inhibitor. The allergic form, right? There you have the it will also be involved with systemic system. You have hypertension, itching, rash, pruritus, and all of that. Okay. While the acquired form, you typically have a middle-aged patient. So hereditary tends to occur in young people, both hereditary and allergic tends to occur in younger people, are acquired in middle-aged to older individuals. So the typical history in acquired is you have a man or a female who is hypertensive. They now started on antihypertensives, particularly ACE inhibitors. And then that ACE is one of the enzymes that break down bradykinin. Okay. ACE is one of the enzymes that degrades bradykinin. And if you're taking an ACE inhibitor as an antihypertensive, it will block ACE, right? And therefore to allow bradykinin to accumulate, leading to angioedema, particularly of the face, so swollen lip and face, and can also affect the upper airway, leading to stridor, laryngeal edema, leading to stridor. So that happens typically in acquired. So you have to stop them from taking ACE inhibitors, right? So the next one we'll be talking about here is PNH. So PNH now is absence of. So what is happening here? There's a gene called PIGA. Okay, phosphorinositol it codes for the PIGA gene codes for an anchor on the cell membrane. So this is it codes for this GPI. Okay, so that GPI is what they are calling here, glycosyl phosphatidylinositol. GPI. What's the function of this GPI? This GPI helps to anchor your CD55 that we mentioned earlier. It helps to anchor it on the cell surface, particularly of red blood cell. And remember, we said CD55 protects the cell, like red blood cells, against complement proteins. So if you don't have your if you don't have your GPI, right? If the PIGA gene is gone or mutated or absent for some reason, right? That means you will not have your GPI on the cell surface. And if you don't have your GPI, that means no CD55 will be anchored to the cell surface, and therefore that cell will be will be open to attack by the complement system, leading to intravascular hemolysis. Of course, when you have the intravascular hemolysis, you have hemoglobinuria, decreased haptoglobin, which will lead to the dark urine and all of that. Another complication of it is this Buchiari syndrome, which is, you have the portal vein thrombosis in besides the hemolysis, you have thrombosis in the portal, cerebral, and dermal veins. All right, in the dermal in the skin. So those are some of the things, complications of PNH. Okay, so I think